Okay, so cholera is a disease that makes a person very sick. So some healthy people and majority of people that contract the cholera will not have any symptoms, and a small group will have minor symptoms, meaning just a little bit of diarrhea, maybe a little bit of stomach pain, fever, and vomiting, but they can recover at home. So then a smaller group of people will be very sick. They will have a lot of diarrhea, and then they will be very weak, and their vital signs will be not good. So they need to go to the hospital. Otherwise, it could potentially lead to their death. So when a person is sick, uh, number one, that person cannot work. So when that person cannot work, then there is the income for that family will be less. And your own cholera is not a 1-2 day disease. You need a lot of time to recover also from that. Number two, they will be isolated. So their family members will have to be isolated. They will not be able to go to work, or they will not be able to carry out their normal daily activities as well. So what I mean is not only the person that is sick will be affected, the whole family and all their close contacts will be affected. Second is, if they are from a poor socio-economic background, how are they going to get medicine? Maybe they don't even have money to go to hospital. They don't even have money to get consultation from doctor. And then they choose to only stay at home, and that will actually worsen the situation. Nobody knows that this family has cholera. People are still going in and out of their houses. It will spread more to other families around that area, and so on and so on, in a poor socio-economic region. The second thing is, when the disease becomes when the number of cases becomes big, it becomes a burden to the healthcare workers and the healthcare facilities in that area. That hospital, for example, will be flooded with cholera patients. Other patients cannot get their treatment. uh, a lot of extra measures will be taken in that hospital to sanitize the area that has cholera patients. For example, each time a cholera patient gets on the bed, after using the bed, there must be somebody to come and clean the bed before the next patient can use. So when you talk about infectious disease, there is a lot more time and stuff needed to control the disease just because it is infectious. So that is also a burden. And then, of course, the government need to spend money on the vaccine. The government need to spend money on sending people to investigate. They need to spend money on cholera kits. They need to spend money on research. They need to spend money on transportation and the treatment for all these people. And sometimes, if the outbreak is so big, they need to call in extra staff. They need to bring in extra doctors, nurses, and other resources to that area. So that is also the effect from a cholera outbreak. Um, what else? Then, of course, if that area is endemic, it will affect tourism. But if for example, if your country is known to be a cholera outbreak area, there will be very few tourists coming in. And the tourist is also a source of income for the country. So I think that's my opinion on that.
Okay. Thank you, doctor, for that answer for the question just now. So for my next question, in doctor opinion, what are the biological control to scrub or to control this spreading of the cholera?
Okay, for the biological control, do you mean human to human spread? If you mean human to human spread, again, number one is hygiene. Number two is early detection. Number three is early notification, so the disease don't spread so fast. Number four would be cholera in Malaysia usually spread from human to human contact. So you have to create public awareness about cholera, about the hygiene of our food, and also our sewage and water system. So if you can standardize it, you know, meaning some areas, all areas have adequate clean water system, and not just the urban areas, like rural areas also should have a very clean water system. Another thing, biological, probably if you mean from fish, because fish are actually host for cholera. So I mean, you should eat cooked fish